Okay, well, welcome to this afternoon's webinar as part of the UCD School of Nursing, Midwifery and Health Systems Health and Wellbeing Research Series. So my name is Thilo Kroll, and before I introduce our speakers for this afternoon, I would like to say a few words about the practicalities for this afternoon. So the webinar is scheduled to run about, well, in total 60 minutes. If we finish early, that's of course okay as well. We will not use any cameras today, and all you will see is the slides of a slideshow advancing and the speakers talk. The speakers will give their presentation, and afterwards we would like to invite you to ask any questions that you might have. And to do that, we please ask you to use the chat box for this purpose, and I will read out the questions so that the speakers can respond. We are assisted this afternoon by our audiovisual expert Justin Dawson, who's helping in case there are any technical difficulties, which we don't expect. But if these problems arise, he will help us with the technical issues. I also would like to point out that we will record the presentation, so anyone who cannot join us at the moment will be able to watch this presentation at a later stage. But now, without further delay, I would like to introduce Dr. Irena Connon and Dr. Ed Hall. Both are based in geography at the University of Dundee. Irena is an anthropologist by background, and Ed is a human geographer. And I had the pleasure to work with both of them on a very interesting project. Today they will present on this topic that was central to a study on environmental hazards, which was conducted in both Scotland and England in collaboration with Scottish and Southern energy networks. The topic for this afternoon is rethinking vulnerability. What does it mean to be vulnerable during environmental hazard events? I think it's a very timely topic if we think of the recent winter storms that have also lashed over Ireland. But moreover, what makes us vulnerable and who is vulnerable? Those are questions that we will hear more about from Irena and Ed. So now, without further delay, I'm handing over the presentation to controls to Ed at first, and then he passes on to Irena. Okay.
Thanks ever so much, Thilo. Thanks for the introduction, and welcome to colleagues who are joining the webinar this afternoon. As Thilo said, I'm based in human geography here at the University of Dundee, and was involved in this particular project over a period of 2.5 years, finishing in October last year. What I'm going to do in my first part of the presentation is to set out some of the context, some of the background around the establishment of the project and its overall structure, and then I'm going to hand over to Dr. Irena Connon to look at the key findings and the conclusions from the project, and then I'll return at the end to round things off in the sense of the broader impacts of the project. So in terms of an introduction, the first thing to say is that this was a knowledge transfer partnership funded by Innovate UK, which is part of UK government, and the purpose of knowledge transfer partnerships is as the name suggests, is to make connections between academic researchers and those mostly in the private sector, companies, both large and smaller companies in the private sector, to transfer knowledge across from academic insights to help improve the operations of businesses in relation to particular issues that they have. And the connection, as you know, as you've been told, here was between the University of Dundee geography and also and then with Scottish and Southern Energy Networks, who are a major power infrastructure supplier based in both Scotland and England, and a particular problem was identified, which I'll talk about in a second, which they wanted our help with. So over a period of time, a connection was made between the university and SSEN, and we formulated the project based on that. So just in terms of what we're going to be talking about today, I'm going to talk a little bit about the project background and the objectives, and then talking an overview, and this is where I pass over around the phases, approaches and methods onto the key findings, and then thinking about how this is the work that we did in partnership with SSEN has transformed the way that they approach this issue around vulnerability in the context of extreme weather events, and then some conclusions and issues for further consideration. So just a quick slide here just to set up the context. This is an image from the BBC News site from the beginning of 2015, and you do a search of any news website over the last few years, and you will see headlines such as this. As we all know, we're experiencing increasingly challenging weather, storms, snowfall, flooding, and so on, which raise a whole series of issues for people's everyday lives. But in particular, we're concerned here with the impact on infrastructure, and even more specifically on the power infrastructure, so the supply of electricity to homes and businesses. And as this story indicates, this has impacted on the supply of energy to people's homes, and it's meant that a significant number of people have been without power, either for a short period, for a couple of hours, and in some cases, particularly in more remote parts of Scotland, for up to a week. And this obviously has an effect on the well-being of people, and in particular, and this is where we come in on more vulnerable people within communities. So the project started off from a position that we were considering older people, people with a disability, people with a chronic illness, families, and others who may find it particularly challenging to be without power over a short or an extended period. Now, I've had an interest in this based on my work on disability for a long time. So this was timely for my own research interests, but also it was timely for SSEN as well. They were facing a series of challenges and investigations from Ofgem, the energy regulator in the UK, and also from the House of Commons Select Committee, asking lots of difficult questions about the reliability of their provision of power, in particular to vulnerable individuals and communities. So they set up, this is the next slide here, a set of strategic priorities to address this. So their concern with vulnerability is very much at the heart of their business strategy, which obviously makes this knowledge transfer partnership so important and so timely. So as you can see from the list here, customer vulnerability at the heart of their business, very keen to identify and respond to this vulnerability, and to deliver, as it says there, an accessible and empathetic service to our priority services register customers, people who have told SSEN that they have particular needs because of age or disability, and support those who become vulnerable during a power cut. So vulnerability in relation to power outages, disruptions of the power supply, very much at the heart of their strategy. But as I said, at the same time, they were under a lot of pressure to improve their performance. So this knowledge transfer partnership was established, ran over a period of 2.5 years, 2014 to 2016. and as you can see down, this is some of the material I've already covered, that SSEN were this issue of how power outages were affecting vulnerable people was very much at the top of their agenda, partly because of the pressure they were getting from Ofgem and the House of Commons Select Committee. So the way we came into this was as a research team. So that was Thilo, Kroll, myself, and our research fellow, Irena Connon, was in partnership with SSEN, was to help them through our academic insight to transform their approach to vulnerability. They knew they had a business problem, that they weren't addressing vulnerability in the most appropriate way, so they needed to transform that, which is where the project began. So the project has 4 different stages. I'll just talk about these very briefly, and then I'm going to hand over to my colleague. So the 4 stages from the top there were for us to, as the project, to identify the set of issues around what vulnerability is, how vulnerability is experienced in the context of power outages and extreme weather in a range of communities, and then to go on to develop some potential responses or new ways of understanding vulnerability in the context of those communities and that disruption, and then to go on through and to help the company to implement and disseminate some of these new insights, and hopefully then go through training and the embedding of knowledge within the company to leave a lasting legacy, which is, just my last point before I hand over, will be that one of the key parts of expectations of a KTP is for there to be a lasting impact beyond the period of the project, so the company is changed both in terms of its culture but in terms of its organization. So I'm going to hand over to Irena Connon to continue the presentation, and then I'll come back near the end. Thank you.
Hello and good afternoon. So I'm just going to continue. We're talking about the project phases and the approaches and methods. So during the development stage, or the identification stage, my role was to go out to the different case study sites and identify what the problems were, why communities were having trouble to respond to the extreme weather events and power outages. So to develop this as best I could, what I did was I decided I was going to take a qualitative approach, drawing on ethnography within the community, so being based within several communities in Scotland and also in England as well, staying there particularly during the winter months as well, so I could see how people were coping with weather within normal range, defined normal range, as well as during more extreme weather, which actually did occur when I was there. And also doing interviews with community members, again just observing, talking to people, and also working with members of responder organisations, interviewing people from the voluntary sector, again within that particular area. So very much seeing what was happening on the ground in terms of day-to-day life, as well as hearing what the people had to say about what happened during the storms, during floods or heavy snowfall, particular areas. So areas I was concentrating on in Scotland anyway, with the Isle of Arran, and also around the Loch Aber area. In England I was focusing, it was initially there in London and in Slough, Bracknell, around that area, and also around rural Surrey, West Sussex area. But throughout, I was able to get a few additional case study sites in the northeast of Scotland, a little bit of information about what was happening in the borders, Scottish borders as well. Another part of the phase of the project was doing focus groups, meetings with members of the community and members of voluntary and also official emergency response organisations at the local level, followed by several meetings with responder personnel at the regional level. So trying to have a look at multi-level, multi-scale approach to find out what was happening at this level as well. So that was to identify what was really happening, and from that develop something that was suited, for all the different people that were involved in this. So the findings from the investigation were, first finding was about rethinking what it means to be vulnerable during a storm event. So what I found from speaking to people and being within the communities is that vulnerability to extreme weather is something that is not down to the presence or absence of one or two key demographic factors. For example, is it about somebody who's elderly or someone who has a disability? Does that make someone automatically vulnerable? And I found that when you're actually in the places, vulnerability is a product of a complex array of factors, and that can be something like the physical environment, so how remote the environment is, surrounding built environment, where your nearest neighbour is, if there's a shop there or some sort of community hub that people gather, again, social environment, how embedded you are in the community, cultural norms and values, and that can be about things like knowing when to ask for help or feeling comfortable asking for help, about where do people draw the line about when too much stress from a storm event or without power is too much, political environment, things like getting resources to the area, which is obviously related to the economic situation, length of residence in the area, so it might be a very cohesive community, but if a person's not been there for very long or they're there sporadically, they themselves might not be able to really experience or participate in this overall cohesion. And also situational daily factors. Someone is having a bad day, someone's car doesn't start that day, someone's experienced a bereavement, as well as a specific weather event. If it's an event that is maybe slightly different to previous snowstorm, or if it's something that's totally different, for example, 5 strikes of lightning within an area putting the power out, something they haven't seen before. And what this does is it within the communities is that people they find themselves able to cope practically, but there's also an emotional aspect too, where people find themselves that, okay, maybe they have resources, but they no longer feel that they're in control of the situation and worried about what's going to happen to the future. So it's not just about practical preparedness, but this emotional side too. But these factors, they change over time to produce a unique place-based experience during each extreme weather event. So you might find that during one particular event, the same person is able to cope, but not during another event, because something within this list has changed at that time in that place. So it's something that changes over time on a continuum. So another finding we got from the project, which is about the complex spatial dynamics of vulnerability. So we found that the strong tendency within the emergency response organisations, as well as within SSEN, for human vulnerability to be, or the approach taken was by looking in terms of simple rural-urban divides of Scotland and England way of classifying the responses. So how do we respond to a rural area, or how do we respond to an urban area? Particularly I found this to be the case with rural areas. You could say a very strong assumption that rural areas were generally easier to coordinate, that people were well connected. They didn't need to have much support to produce resilience plans in these areas. But what we found was that, especially when we called for the focus group meetings participants who wanted to come along, they said, yes, we have that, but it only covers certain members of this community, or only certain people get involved. Others were saying, when I was actually staying in the communities as well, they might have that, but it's something they themselves weren't familiar with, because rural environments have changed over the past 30 years. You have the rise of commuter areas, you have infrastructure like village shops and things closing, rise of second homes. So residents now vary in their abilities to cope because they don't have necessary what I call social capital or social support networks to be able to cope. And also with rural employment patterns changing, a lot of people are less often employed in things like agriculture or fishing, and they're not as involved in many cases with the landscape or with the know-how of the floodplains of areas, the complex knowledge that maybe some of the older generations or long-time residents have, which again can create problems about knowing what to do, when to plan ahead. And same, with urban areas, there was a assumption made by the emergency responders. Often these were difficult places. You had to take a more individualized approach. People in urban areas didn't know what they were doing. They didn't have a strong sense of community. And what I did find, particularly in Slough, was that you had very strong communities, again often hidden from public view, but very strong within the communities. If you wanted to pass a message on, and you would get the message passed on, and it was communities held together by interests in particular things, even by religious groups or just complex family dynamics. So there were communities, but they weren't necessarily tied to the geographies of place. So the spatial dynamics were a little bit more complex than was being accounted for by the existing system. And the third finding was about the significance of the cultural norms. Okay, that means social cultural norms on the ground, things that influence how people behave, what their attitude is, and how they respond during the situations. We found this was particularly important for understanding and also for being able to design something to try to mitigate vulnerability. What we found, particularly in Scotland, was embedded cultural norms about asking and offering assistance or sharing of personal details had an impact on whether people were willing to say, I need help, or if they put a call out saying, tell me if you need help or who needs assistance. People were saying, no, if you had this idea it was normal that you could tolerate these temperatures, it's what you defined as normal. Also, how you felt about asking for help. Did you feel that you were maybe taking resources away from others? So your approach to other people as well as yourself is defined, long-term cultural norms, which embedded through history, very strong political element, even educational element to that too. But of course it influences how people respond if they fall into difficulties, and also what the emergency responder groups could do about it as well. So again, also understanding these norms I found important for looking at why formal community resilience initiatives could be successful or limited. Again, if people are reluctant to share information with outsiders, which is something we found particularly amongst older generations in both places, if someone phones you and says, are you okay, do you have everything you need? People will say yes, because to them it's the family should notice, or someone that they see face-to-face should notice, but without saying, do you want help? The onus should not be on the person to come forward. So that obviously impacts how an official, one-size-fits-all model could operate. Again, the norms differ from place to place between different generations and change over the course of time. So I'm saying that while I thought older people were more reluctant to admit if there was a problem than younger people, I also found over the course of the duration of the project that younger people were saying, I'd be less reluctant to admit to having a problem now because people think young people are entitled, they ask for help. So they were sort of internalizing some of the negative attitudes from the media towards themselves in how they were approaching their own situation and what they thought that they or what others should do about it. So it's also important for looking at responsibilities there. So other important key findings from trying out various different approaches and getting opinions about different approaches, found that taking a proactive and localized approach to preparing for future emergencies does help mitigate the uncertainty that leads to vulnerability during the power outage. So that's the emotional uncertainty, but also the practical side as well. So if people are prepared in advance and the preparation is done with a local context in mind for that place, people are more likely to be prepared. Again, responses and ideas for future planning heavily influenced by wider present and past political context as well. So what people were saying, I would prefer a proactive approach, I think that would help. Again, over the course of the duration of the field work, people would then say to me, well, I'm not very keen on this community resilience aspect. It's a top-down government thing, which is saying they're going to hand power to the local communities, but it's about giving them power to do what the centralized government wants. I know there's a lot of concerns about cutbacks. It's transferring an unfair burden of responsibility to others. So about how much input an energy company or official organization or individual should have was very much determined by what was happening politically around that. Again, something I also found that's maybe quite underexplored really is there's a gender dimension to the concept and practice of resilience in the UK disaster risk reduction context, particularly with, in the past, it's been very much an emergency management way of approaching this, which for various reasons can be defined as a particularly sort of masculine approach, and also gender norms, the way that gender or ideas about gender, even sexuality, even play out during the actual response as well as the planning for this. Again, it's more complex, very complex situation, but there's a strong gendered element to that as well. Traditional methods of community engagement that they were using, which is going to a community, finding one person, maybe a community councillor or someone who's very much involved in local organisations, would be able to disseminate the information about resilience. We found that that could actually enhance the marginalisation of those most vulnerable, because what we found, particularly in Arran, was that people went, people said, oh, the impression that I was given before I went there was that this was a very resilient area. Everybody was happy with the official resilience plans, and then when I went to the meeting I found that that was certain people were not happy, but they felt they weren't getting a say, which they were eager to let me know about. So again, if people don't know how to access those key contacts, it marginalises those who are already on the outside because maybe not socially embedded as others. And the presence of a disability, so if a person's got a disability, it doesn't automatically mean the person's more at risk. What we found is those who perhaps had a disability or condition that was lifelong, they had medical equipment and things that were dependent on electricity, but they were quite well prepared in that they had either been through this before and had learned some lessons, or they were able to access spare batteries, oxygen tanks, machineries. They knew the carers, they had a response system in place. They were generally quite well prepared. But if you have someone who had a recently acquired disability or medical condition, they're in the process of adjusting to getting used to the disability, the medical condition, and thinking about how to prepare for the possibility of a future power outage was not something that was particularly high on their agenda. So they were struggling with more what to do as well. And again, also maybe not the same sort of care system in place. Again, also found if somebody's medical condition got worse during very recently compared with what they were used to, again, that also puts someone more at risk at that particular moment in time. And again, another thing which I ended up developing into a small mini project on itself, into very other areas, was the relationship between fuel poverty and vulnerability. And a lot of that is to do with people who are unwilling to ask for help or unwilling to lean on support services available because of concern that this will mean that the bills will rise. You also have a long distrust of energy companies or who's involved, and then if you hear that the energy companies and governments together were involved, it was seen as something that they automatically framed as something that was against them, something that would have negative consequences, even however well-meaning due to the nature then of the market, of a business, of the private sector. It would be looking at financial gains above other things as well, which raised a few important questions about resilience. Well, a lot of it is about when people say that they would like to have more initiative, but a lot of it depends on who they see as being responsible for leading it and what negatives, or any negative side effects that they feel will be attached to that as well. But communicating the findings the other way, so reporting this back to the to SSEN itself, and through the work of trying to embed this within the company, started with transforming how the company approached vulnerability. So by saying, rather than it being based about whether a person has a disability, whether they're over 65 years of age or dependent on medical equipment, saying it's a much more complex process and a much more changing process. It's one of scale, one of multiple factors. So that was the start, and we had quite a bit of success with that, particularly at all levels of the company. And the quote here is from Jennifer McGregor, who's head of stakeholder engagement strategy, who explains that we now think about, or that they now think about customers in vulnerable situations rather than just simply vulnerable customers, because they realise that this is something that is tied to space, time, place. It's to do with history, it's to do with past, present, how they imagine their future, and also changes in weather. And it's not something that doesn't require just a technological solution. It requires something more. So that was from Jennifer McGregor. So in terms of developing the findings, it's taking it from the field site, to transforming approaches, policy and practice more widely. So the thing I did was about rethinking resilience, the concepts, policy and practice. What does it mean, and what does it mean for all different emergency response groups? Developing and implementing the SSE PD toolkit to drive the process of transformation. So saying what I found the company was doing, what I found other organizations were doing, and what should perhaps be changed according to what the community members themselves want or need. Again, big part of this was rethinking about the structure of the civil contingencies framework and legislation, which is what drives the official emergency response, who does what. Saying that, well, the way that roles are defined there are perhaps maybe a bit too rigidly defined for how, or for the character then of society in different places throughout the UK. So it's about rethinking who does what, rethinking roles, responsibilities within what we might call resilience practice as well as policy. So rethinking that. Disseminating findings to an international audience to influence approaches to disaster risk reduction. Another part of it. Communicating findings to partner organisations, things like how advice about how they could rework the media strategy, particularly in Scotland as well. And again, communicating findings to specific communities and at wider public engagement events. So, and that was done both at the case study sites and also and more widely as well. And then from that, we also able to build into a vulnerability mapping tool, which Dr. Ed Hall and I think another colleague here were able to do based on this idea of the spatial dynamics of vulnerability. So I'm just going to pass you back to Ed Hall, who's going to tell you a little bit more about the vulnerability mapping.
Thanks very much. Okay, just want to say a few words about this. The vulnerability mapping was an additional piece of work with the Knowledge Transfer Partnership, which SSEN asked us to do. I think once they got their head around the fact that vulnerability was more than individual vulnerable people and was more complex and involved a whole range of factors, they began to see the benefits of trying to understand the communities where they supply power to and where they're based, and to therefore have a more sophisticated understanding both of how to respond in a power outage situation, so where they should send their resources to, where needs to be put back on power first if they have to prioritize, but also the mapping is now being used within the company in a preventative way, in a proactive way, so where they should best target their investment in relation to making their power supply more robust, putting in with partners, organizations, extra resources, information, so on, so that in advance of there being a power outage, they can put people in a better position to deal with that. So that's been a really excellent additional output from this work. Just gonna hand back finally now for some conclusions and some questions to set up some discussion at the end.
Okay. Hello again. So the vulnerability mapping. Okay, so now moving on to the conclusions and issues for further consideration. So the main achievement of the project, the KTP project, has been in transforming understandings and approaches to mitigating risks to human well-being during extreme weather events. So again, starting with transforming the understanding of what vulnerability is and using that to then drive the process of change. So however, there's some issues for further consideration, which I think are very important within this. but does it still make sense to talk about community resilience in the wider context of societal transformation? So we talk about community resilience as a plan of the resilience division focusing at the community level. But again, we need to define what we mean by community, but also how can we implement at a community level that's become increasingly fragmented as society becomes, we have space-time compression through things like globalization, we have increased mobility, we have more transient employment, so that, spatial relations between people have changed, and it changes community. So again, something we need to bear in mind within that. And again, does the formalizing of local knowledge by planning or planning for risk hinder local coping capacities by removing what we might call the spontaneity of adaptation that characterizes successful approaches to managing risk? So one idea behind community resilience is for people to, with the communities, write out plans for what to do should another storm happen, where they can obtain help, who to contact, and again a system for about who should check up on whom to make sure everyone is okay. But one of the things I did find that in sectors within, particularly within some of the smaller communities, where things were working well, was what we might call a spontaneity of adaptation, where they were able to make sense and respond more or less on the spot. It seemed quite instinctive. They would observe what was happening with the weather and then act accordingly to say, right, okay, so the weather's getting worse here, that road will be closed here, that path will be here, I know who lives there, and then go and visit them, check they were okay. So a certain spontaneity that was there. Also at that time, they knew who was ill on that day, who was away, who wasn't, if providing they were embedded within that. But this was partly key to the success of being able to manage a bit of the uncertainty, or one of the phrases that people kept saying to me was that no two storms are alike, you've just got to see what happens. But they were still able to act accordingly, so being able to cope with that was a big part of managing risk. Now, if you have a plan where everything is written down, one of the objections to that is that people then start following the instructions or the directions given on the plan and miss the spontaneity, because something will happen during that day that perhaps they haven't considered. It could be a bereavement in the community, it could be all sorts of things. They're not considering it because they're not aware of it maybe, but they follow the plan and something happens. Or because it says in the plan that one person must check on 4 people, it's written in the plan this way, but in the past somebody has checked on that person because they were the friend, and they think, oh, that's in the plan, so someone else will be doing it, so they don't check as before, and someone could come to harm, or something goes unaddressed. So that spontaneity can be removed. And again, another point again is that does enhancing resilience to the impacts of environmental change actually create sustainable communities, or does it detract attention away from larger questions of transformation for sustainability? And by that I mean it's focusing on mitigating the risks. So it's not suggesting we do anything at the deeper level in terms of addressing climate issues or issues of inequality in society, even issues of representation within some of the community political structures. It's not really looking at the deeper level, it's addressing something. I think if everything is focused, or all the energy is being generated towards prevention of harm during the storm, is that detracting people's attention away from what's, some of the wider issues, for example, developments, designing the built environment for sustainability, or for renewable energy, these sort of questions. Okay, and that's something that to keep in mind there. There's some questions that we can pose for discussion, which are again for various different responses from posing these questions elsewhere to date, but something that would like everyone to consider, these 4 questions here, which is how do we best measure, assess and identify vulnerability? And what are the benefits, limitations in moving from a reactive to a more proactive approach to mitigating vulnerability? So not just responding to emergencies, but planning of how you might respond before the situation occurs. And how do you think we can best understand vulnerability in the context of communities? So it's 21st century communities, a bit more complex, and I think some of the definitions that the responders rely on we use. And also, where does the responsibility lie for addressing vulnerability, and what are the implications of this for partnership working? So a lot of questions about the responsibility for safeguarding well-being. Who does it lie with? Who should it lie with? And again, if it's something that people should feel they should be equally responsible for, or in different organizations, how can we ensure that happens through people working together? Okay, so thank you.
Thank you very much, Irena and Ed. This was terrific to walk us through the complexities of the study, but also these really exciting insights. And I think the quotes that you listed to shift our understanding from vulnerable people to people in vulnerable situations, I think that brought it home quite nicely as well. I'd like to invite now everyone who listened in to ask questions, and we, like I said initially, we use the chat box at the bottom, so you please pass on any questions that you might have. And to kickstart it off, I might ask you, now what was intriguing to me is sort of this notion of we're moving away from just vulnerable individuals also to community setting, and the vulnerability mapping exercise that was undertaken. Now, is there risk with this kind of map that you draw up, that you perceive this map to being quite static, in terms of once you have a map, you file it away and say, okay, that neighborhood, is at high risk. Does that contradict a little bit sort of this notion of, people in situations or the constituents of that community might be actually at variable risks over time?
Yeah, I guess, in my the way I see it, one of the issues, or one of the main risks with the mapping of vulnerability is that at the moment, if we actually bring this up on, if we can, bring it up on screen there, the areas that they've highlighted in the darker colours are areas that they've identified to be vulnerable, and by that, what they're meaning at present is that area contains the highest number of people who, in this case, what we're measuring is how many people speak English as a second language within these areas. So it's measured, they define the areas as vulnerable in terms of the number of people. So it could be the number of people with disability, number of people who English is a second language, numbers of people out of work, things where you are you're highlighting certain areas. But my issue with more is it's measuring in terms of the number. Now, in these particular areas here, this covers some of the areas where I did some of the work, and I found that in these areas, yes, there were a lot of people who spoke English as a second language, but some of them had the strongest sense of community. And in particular, if you take Slough, it was something that was actually embedded in the history of the place, because more or less through the last century, it was a place where people who were arriving from abroad, they would go to Slough, they had connections in Slough, they put them in touch with others if they weren't going to stay in Slough, or they would settle in Slough, take jobs there. It has a history almost inbuilt into the dynamic of the place, of a place where people would come into the country, and they had a sense of community, extended families, extended support networks, which people said were very keen to say to me it was part of the history of the place. And I found there you had particularly very strong communities. Sometimes it was a place-based community, but also around particular activities where the sense of community was actually very strong. But again, it was identified here as vulnerable. And some of the areas around further towards the top left of the screen there, where they're identified as not particularly high levels of people who have English as a second language, but people in that area could be very vulnerable because they were not living. They were living in more with less built-up areas. They were commuting to work. They had friends all over the world. They were more transient because of their work. They had plenty close friends, but located right across the world. They were in good jobs. And then, of course, if there's no power, they can't get on the internet, they can't speak to their friends. Of course, who do you turn to if you have problems? You turn to your family or turn to your friends or turn to others for information that they can't get hold of. And again, I found some people in these areas and situations to be very vulnerable. So there is an issue with mapping, where you can give quite a static representation. I guess one way you could map this a bit differently is to explore how many people within that area are new to the area or don't have family connections or friends within an area, because that would look at actual characteristics of being embedded within a community, would give a little bit more emphasis on that. But again, it doesn't really capture how it changes over time.
I guess it's interesting, because I guess you could have several layers of potential dimensions of variables, put onto this map, and shade them accordingly, and you could do this repeat mapping, almost like a weather map, where it changes from time over the course of whatever the time frame would be, a year, a month, and maybe also in response to particular events that happen on the ground. So you could I guess feed in real-time information in some degrees, but it's really fascinating. Now the other thing that struck me in terms of you mentioned resilience and resilience plans, and sometimes people who talk about resilience assume that resilience is in some magic way the flip side of vulnerability, or they just talk about one side of the equation, or it's an equation at all. But in terms of vulnerability, you pointed out, that there, because it's a multi-level, multi-system, multilateral concept, that there might be mitigating circumstances, situations, traits, characteristics, whatnot at the individual level and the social and socio-political, societal level. So how do we, I guess I throw the question almost back at you, how do we capture that, this complexity?
How do we capture it in terms of a particular model or particular
to make it useful, sort of in terms of actionability in the future,
okay.
In terms of is there a way to?
I would I think the approach or the way that I took the approach within this project, by starting out by looking at what's really going on, not in terms of necessarily how the official organizations are defining vulnerability or even resilience or adaptation or these sort of things, but looking at how people see it themselves. And in terms of rather than focusing a model or looking at defining or distributing resources to an area, emergency support, based on how many people within a particular area are likely to not have the support network or are dependent on medical equipment or these sort of things, moving away from sort of you could almost say some of the more numerically driven processes and looking at the degree of vulnerability, because it could be that although there are 5 or 6 people within, say, a small area who are dependent on medical equipment, they all have backup batteries, generators, all quite used to it. But in another area where they are maybe closer to a hazard, they don't have a family within that area, and their disability has recently got worse, and we're looking at more qualitative approaches, so defining vulnerability. So I think the way to capture that is to understand the local context in which it's occurring. So, for example, if we look at the map again, you have an area here which is highlighted as being vulnerable because in that area there are a lot of people who have English as second language, and yet if you know that area, if you go for this very localized approach, drawing on information in the area from expertise within the area, you find that this particular group can be difficult to reach out to with official information, but they are well integrated. So if one person has access to the information, who can then pass it on to others, whereas in other communities you might find that it's easy to get the information out to one or two, but it doesn't get passed on as well. So it's about taking a localized approach. It's about knowing the environments, knowing the places. So moving away from top-down, one-size-fits-all approaches or models, and taking it either maybe more regional, preferably a more local level, drawing on local knowledge and local understandings, and again, local social dynamics as well. Because if you have groups where there are different social groups within even a small area now, when things becoming quite diverse. So lots of different social groups, but not much what I might call bridging capital between maybe those who've been there for a long time and some of the newly arrived residents, and that can make it difficult for information that's passed on to be passed on to others. So it's again working with who knows the area, who knows has an overview, and taking it from there really. So yeah, you really have to know the local situation.
So I guess that's sort of the general. I mean, maybe one of the generic lessons we can draw also from this. So look at the local. Locality matters. Understand the thought leaders. The whole information flows and this. We just get one comment. I'm just going to read that out. So congratulations. And this seems interesting. The participant here says, this seems so interesting. I work with the Venezuelan indigenous community, and I think we have their work vulnerable not only to them but to them, so that they could identify what vulnerability and work on them by discussing groups of drawings. For the strategies. Yeah,
I think that's a really interesting comment, that, because saying you have to bring vulnerability to them. Again, when I was speaking about the culture, some of the cultural norms, especially in some of the rural areas in Scotland, where people did not see themselves as vulnerable, there was also a resistance to it, because just because you are old, you are not vulnerable, and to be in need or to be vulnerable was seen as being quite selfish in there. To them, it was this idea that you are therefore, there's always going to be someone worse off. You are taking resources away from them, so you don't make a fuss and you don't tell people. And again, you saw that in other areas as well. But people do not always see their own vulnerability, because that is something that they take as what we call cultural norms. It's things that they take as normal, things that they take for granted. Same as with the responders, they have assumptions about particular areas that they take for granted, or about what people are looking for. If people are looking for, we think about resilience, the approaches, we also have to, they fit the local area or be locally driven, because if it's, as I said, over the course of the project, first this idea of local plans, that was something that was moving away from central control. This was something that was great, but then people associated that with a particular political agenda, which they felt was quite negative, which was unfair, transferring responsibility unfairly. So again, a lot of it is about managing perceptions or expectations, and also how people see themselves, because you don't want to go in and say you meet this particular criteria, or you're in this situation, you therefore must need help or you should need help, because again, that's, if you're going to empower people, going without an approach like that does risk having the opposite effect if not done again with particular care, in a particular way that is responsive to what people at the local level want.
And if I can just draw out maybe some other potentially interesting lessons for areas that we are currently here in Ireland so concerned about, we see that debated in the media in terms of health and healthcare systems and health delivery, and we have daily reports on overfilled and overcrowded hospitals, and I look at this this piece of work and think okay, maybe we got it wrong, maybe we need to think about the things that lead to the overcrowding and the understanding the cultural norms. We have differences across the country, and it's not just a matter potentially of staffing ratios within hospitals or discharge patterns, but it's understanding what brings these numerous expectations into hospitals, and what makes people first of all access those services, and what don't we have on the ground, and how do we need to understand the communities and contexts in greater depth.
Yeah, I mean, that's something. But I guess you're saying it's expectations, but I think also resources as well. I mean, it's about if you're going to transfer resilience to the community, they must have the resources to be able to put that into place. And I guess it's the same with, whether it's community care or centralized care, a lot of it comes down to a question of resources and financial means to do that.
Absolutely. Well, I think I'll draw it to the close there. So thank you very much again. I think that's very helpful, very insightful, and hopefully we'll have more people to listen in to this webinar and pick up this presentation in the future. So we'll circulate the link more widely. So I would like to thank you, Irena and Ed, for your time, for presenting this very interesting and inspiring overview. Also like to thank all the attendants and participants who listened in, and also to Justin for all his practical support and help with getting these webinars up and off the ground. And lastly, I just would like to tell people about another webinar which we have scheduled for the 15th of March, where Jenna Breckenridge and Anna Salzberg from Scotland will talk about something entirely different, but they will talk about care homes as a cinematic community, which is another very interesting little project. And so thank you very much, and hope to listen in again, and see you soon.